You're watching the ZNS Health Zone. ZNS Health Zone is sponsored by Doctors Hospital. Also sponsored by Save More Drugs.
You're tuned into the ZNS Health Zone, sponsored by Doctors Hospital. I'm Shashina Rolle Parkinson. As always, it is so great to have you with us. Tonight, we focus on the spotlight on rheumatology. What is it? What are the symptoms? Are you at risk? All of these questions answered straight ahead when the ZNS Health Zone returns.
You're watching the ZNS Health Zone.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases across multiple specialties, including rheumatology, dermatology, gastroenterology, and endocrinology. We also provide the latest in therapeutic options for COVID-positive patients. Why choose Doctors Hospital? We provide quality, highly specialized care with Doctors Hospital physicians and trained infusion nurses you can trust. Seamless medication approval through our pharmacy and registration services, a safe and comfortable environment, cost-saving benefits with copay waived on medications for insured LAMP members, payment plans for the uninsured, and immediate access to emergency services. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it?
In Grand Bahama, our LAMP just got brighter. Introducing LAMP Ultimate, from unlimited urgent care visits
So we're just going to give you some oxygen.
to unlimited primary care visits,
How can we help today?
from unlimited x-rays to unlimited ultrasounds.
My baby!
And spend no more than $40 on non-specialty medication. LAMP Ultimate is the affordable healthcare plan that you've been dreaming of, and it's only available at Doctors Hospital in Grand Bahama.
We all need to save time, gas, and money. Shopping at Save More can help you do just that. Make us your first stop for all your prescription needs and medical supplies. Get all your health and beauty items at the same time. And don't miss our huge choice of snacks to satisfy your cravings. And the largest vitamin selection and over-the-counter relief products. Need diapers and other baby care items? First stop. The new section for makeovers, cosmetics, and beautiful jewelry will make you sparkle for that next special event. Save More Drugs, your more store.
In Grand Bahama, our LAMP just got brighter. Introducing LAMP Ultimate, from unlimited urgent care visits
So we're just going to give you some oxygen.
to unlimited primary care visits,
How can we help today?
from unlimited x-rays to unlimited ultrasounds.
My baby!
And spend no more than $40 on non-specialty medication. LAMP Ultimate is the affordable healthcare plan that you've been dreaming of, and it's only available at Doctors Hospital in Grand Bahama.
We all need to save time, gas, and money. Shopping at Save More can help you do just that. Make us your first stop for all your prescription needs and medical supplies. Get all your health and beauty items at the same time. And don't miss our huge choice of snacks to satisfy your cravings. And the largest vitamin selection and over-the-counter relief products. Need diapers and other baby care items? First stop. The new section for makeovers, cosmetics, and beautiful jewelry will make you sparkle for that next special event. Save More Drugs, your more store.
Welcome back to the ZNS Health Zone. Joining me now is Dr. Anishka Rolle, a clinical rheumatologist and Director of Infusion Services at Doctors Hospital. Thank you so much for being with us today.
Hi, Shashina. Thank you so much for having me.
So first of all, let's start off with your role at Doctors Hospital as a clinical rheumatologist. What does that entail?
Thank you so much for asking. As a rheumatologist, I see
all autoimmune diseases that affect the musculoskeletal system. So that encompasses both the bone and joints as well as the muscles. I also see all forms of arthritis, which includes the mundane or mechanical osteoarthritis that everyone is familiar with as you progressively age. But I also treat autoimmune arthritis, and that typically includes rheumatoid arthritis, arthritis associated with connective tissue diseases. Most people are familiar with lupus and other forms of inflammatory arthritis.
So typically when we think of rheumatology and we think of arthritis, we think that this really affects older people. But you see a lot of young people, you see everyone. Talk about that and the different types of rheumatology that you see.
Sure. The mindset for most people is that arthritis affects, like you mentioned, only the older population. But unfortunately, arthritis has no, discrepancy for age. I've seen young kids, from babies to, like you said, the octogenarians that have arthritis. And this is because arthritis in itself can be from many reasons and many causes. Like I previously mentioned, mechanical arthritis or osteoarthritis, which is what most of us are commonly familiar with, is the type of arthritis that I, as a rheumatologist, would provide medical management for, but also early interventional options. And that includes things like intra-articular injections, whether we use steroids or gels, other forms of therapy like physical therapy, occupational therapy, and the list goes on. But the type of arthritis that I see affecting our younger population in particular includes inflammatory arthritis. Again, that is a wide sum of arthritis, and it includes arthritis as simple as gout and pseudo-gout, which most of us might be familiar with, but there's also the autoimmune arthritis associated with, for example, rheumatoid arthritis, which has systemic symptoms, psoriatic arthritis, the spondyloarthropathies, which by themselves are very difficult to diagnose and usually takes about 7 to 15 years or more to get a definitive diagnosis. And then the arthritis associated with connective tissue diseases, which includes a significant amount of different options in terms of arthritis. But the more common connective tissue disease that everyone is familiar with is lupus.
Lupus. Let's talk about some of the symptoms that people may experience where they may possibly be diagnosed with rheumatology or arthritis.
Right. There are sentinel signs and symptoms that I think everyone should watch out for, and that should pique the clinical acuity of your regular doctors. And that includes any persons that are complaining not just of a single joint, or even if it is a single joint actually, multiple joints, whether they happen, whether symptoms happen at the same time or in a migratory pattern, arthritis in which there is significant flares, and those flares are characterized by swelling, excessive pain, as well as limitation in range of motion at the joint. Stiffness is not, it's a good sign to help with your clinical evaluation of these patients. However, we can get stiffness in mechanical arthritis as well. So it's when the stiffness happens, and I always tell patients, if you wake up in the morning after inactivity and you're stiff, can't open your hands, then that is more suggestive of an inflammatory arthritis. Arthritis that is associated with systemic symptoms, and that includes things like fever, unintentional weight loss, anorexia, excessive fatigue. All of these things are signs that say we should look for something deeper as opposed to just treating the typical wear and tear arthritis.
And how do these types of arthritis, how do these impact patients?
Well, unfortunately, most of the patients I see, there's significant impact on the quality of life of these patients. And by that I mean, many of these patients have difficulty going about doing just simple everyday tasks. For example, toileting, combing their hair, putting on their clothes. So it definitely limits their ability to be productive. That being said, for those persons who are in the working force, rheumatology is the most common, rheumatic conditions I should say, are the most common conditions in which people actually have to leave work and come out of the workforce for, because they just cannot cope with either the systemic symptoms that I just mentioned, or because of the chronic pain, limited functionality, and in many cases, disability if the disease goes untreated.
So let's take it back to children. Your child may be complaining constantly of joint pain or have some swelling. Sometimes, as parents, we say, hey, that it's just growing pains. When do you take these types of complaints from your children seriously?
Right, that's an excellent question, and it's also loaded because there are many instances in which you will have different things, for example, a fall, a sprain, and just growing pain in kids. But what I tell parents all the time, and just the general public, anything that's consistently happening, like you have chronicity of the pain, and many children, particularly those under 5, might not express that they're having pain, but you might see that they stop playing. They won't go outside anymore. They refuse to move. So these are things that you have to be kind of put on your acuity to look at and say, what's going on with the child. Or if you have a joint and the joint that you see is definitely deformed or inappropriate, different from how another joint looks. And that I say that for joints that we can easily say, like for example, the knees or the ankle, for example. But the main thing is the chronicity of it, the severity of it in terms of is it affecting their play, their normal activities, and if you as a parent just feel, there's nothing wrong. I tell people when you have that intuition that something else is wrong, please just go and get, even if it's a second opinion, get extra or additional care.
Take us through the process of the diagnosis for rheumatic conditions.
Okay, so when I try to diagnose a rheumatic disease, these are the things that I do. Automatically, as in any physician, we try to get a detailed clinical history. 2, performing an examination, in-depth evaluation, I should say. And then the other things which are add-on, which includes the clinical evaluation through labs and through imaging. For rheumatology, we are heavily burdened with lab values that help us to formulate a diagnosis. However, I tell all patients, labs alone do not give you a definitive diagnosis. So it's the combination of the clinical evaluation, the examination, and the labs. And we use that to formulate our diagnoses. Now, not all things are equal. Sometimes it takes a little more effort in terms of what we have to do. I'm almost like an investigator sometimes, because getting one lab does not mean, again, that that's definitive. We get this question all the time. Doctors come to me, patients that have a positive anti-nuclear antibody. Again,
what does that mean?
I was just going to get into that. We deal with antibodies, which are simply proteins that the body produces. Unfortunately, when I say auto, these antibodies are actually acting against oneself. So these antibodies have, their clinical manifestation is by attacking certain organ systems, and that could be the joint. In other cases, it could be the kidney, the bone marrow, etc. So the list goes on. So when we evaluate patients, we look for standard or basic antibodies, and then we use those antibodies to drive our clinical evaluation further. So I'll just give you an example for lupus patients. They typically will have a positive ANA that happens in over 90% of lupus patients, and that's the anti-nuclear antibody. Does that mean someone has lupus? Not necessarily, not if they don't meet the clinical criteria that I had mentioned earlier. But beyond that, when we get that positive ANA, and depending on one, how high that is, the clinical symptoms that the patient has told me or that I can see as clinical signs, then we go on to do further testing to look at extractable nuclear antigens. And again, those are just other specific tests we do to get a diagnosis of what the connective tissue or autoimmune disease is.
What are some of the challenges when it comes to diagnosing a rheumatic condition?
Right. Again, on that same note, going back to getting laboratory and imaging evaluation, the challenges are many, and primarily I see in our population is the cost. Most of these labs are very costly, so it's cost prohibitive for the general population, particularly those that are not insured. Unfortunately, there's nothing really we can do because most of our labs as a specialty are send-outs, and so most of them are not done locally, and that's one issue. But we have many labs that do provide that service, but again, the cost is an issue. The other thing is when we do labs, for example, like I had just mentioned, because a lot of cinching the diagnoses or getting more information requires, doing repeat labs or doing extended panels. Again, that's one issue. Another problem is in imaging. Sometimes we have to do significant imaging and surveillance and monitoring of patients who are at high risk for certain systemic symptoms associated with our autoimmune diseases. And I'll just give you an example. For persons who have myopathies, for example, we do EMG and nerve conduction testing, which again is very costly. For persons who have at risk for bone loss, like osteoporosis, we do bone density scans. And for persons who have interstitial lung disease or some type of cardiac involvement with regards to their connective tissue disease, we have to do regular screenings with CT scans of the chest, high resolution CT scans of the chest as well, echocardiograms, and so the list goes on. So there's a lot of imaging, a lot of diagnostic workup to sometimes come up with the exact connective tissue disease and to be able to prognosticate in terms of how the outcome would be for our patients.
Now, I know you touched on patients with lupus may have these types of rheumatic conditions. What other type of autoimmune diseases do you see?
Right. So the gamut of autoimmune diseases, we can talk all day, but primarily I clump them into groups, and we have the myopathies or inflammatory myositis, and those patients typically have severe weakness as the hallmark of their disease. So these are persons who can go from regular lifestyle, like you and myself, walking and not be able to walk in a matter of months. Wow. So that's one. The other types are vasculitis, which includes inflammation in the vessel walls that can be small or large vessels. And so these persons are at extremely high risk for mortality and morbidity, unfortunately. And that's because vascular involvement, for example, in the brain, puts you at increased risk for strokes and seizures. If it involves the heart, it puts you at increased risk for cardiac disease, including acute coronary syndromes or a heart attack. And so the list goes on. In terms of arthritis and autoimmune disease, the more common ones I treat include rheumatoid arthritis, psoriatic arthritis, spondyloarthropathies, which includes the spine. And so, yes, there's a myriad of a host of other things that we can treat. And I'm sorry, I forgot to mention that with the connective tissue diseases, beyond lupus, there are other connective tissue diseases like scleroderma, Sjogren's or Zika syndrome, overlap syndromes that we see I see a lot in the population.
Thank you so much, Dr. Rolle. Stay with us. When we come back, we talk about prevention, and we also talk about some of the latest advancements when it comes to the treatment of rheumatology. Don't go away. The ZNS Health Zone is back right after this.
You're watching the ZNS Health Zone.
In Grand Bahama, our lamp just got brighter. Introducing Lamp Ultimate. From unlimited urgent care visits
So we're just going to give you some oxygen.
to unlimited primary care visits.
How can we help today?
From unlimited x-rays to unlimited ultrasounds.
My baby.
And spend no more than $40 on non-specialty medication. Lamp Ultimate is the affordable healthcare plan that you've been dreaming of. And it's only available at Doctors Hospital in Grand Bahama.
We all need to save. Save time, gas, and money. Shopping at Save More can help you do just that. Make us your first stop for all your prescription needs and medical supplies. Get all your health and beauty items at the same time. And don't miss our huge choice of snacks to satisfy your cravings. And the largest vitamin selection and over-the-counter relief products. Need diapers and other baby care items? First stop. The new section for makeovers, cosmetics, and beautiful jewelry will make you sparkle for that next special event. Save More Drugs, your more store.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases across multiple specialties, including rheumatology, dermatology, gastroenterology, and endocrinology. We also provide the latest in therapeutic options for COVID-positive patients. Why choose Doctors Hospital? We provide quality, highly specialized care with Doctors Hospital physicians and trained infusion nurses you can trust. Seamless medication approval through our pharmacy and registration services, a safe and comfortable environment, cost-saving benefits with copay waived on medications for insured LAMP members, payment plans for the uninsured, and immediate access to emergency services. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to the ZNS Health Zone, where we shine a spotlight on rheumatology with Dr. Anishka Rolle. Thank you so much, just giving us a wealth of knowledge when it comes to rheumatology. We want to talk, though, about prevention. Can this be prevented, these types of conditions?
So prevention is a very important thing because I get that question all the time by multiple patients. However, some of these diseases, again, not related to what the patient may have done. So we mean, for example, social exposures will not affect the outcome or even just getting these diseases, I should say. More mechanical arthritis, there definitely is a role for prevention, and that includes, for example, particularly when we talk about our large joint disease in terms of osteoarthritis like the knee and the hips, etc. That includes living a healthy lifestyle, meaning being appropriate weight, body weight or BMI, being active, and eating a healthy diet can prevent some of the types of primary osteoarthritis. Again, though, for example, those persons who might have primary hand involvement, then those things don't apply. And this is why there's a little bit of issue. In terms of the autoimmune diseases and the inflammatory arthritis, I'll start with inflammatory arthritis. There are some lifestyle things that can be preventative. For example, avoiding smoking, or nicotine use, or even secondhand exposure, particularly in patients who have rheumatoid arthritis. But for the most part, the other inflammatory arthritis, they are not preventable and typically are caused by either some genetic changes that happens that causes, onset of these diseases. In terms of the connective tissue diseases, again, some risk factors include, for example, sun exposure in the case of lupus, but most persons still have a genetic predisposition to these diseases or have had exposure Again, we can't really map the time from exposure to, for example, infections like viruses, the EBV virus, particularly in lupus patients, or exposures to certain toxins that might cause them. There are some drugs that can lead to the onset of some connective tissue diseases in the case of lupus in particular. And so these are the preventable options, but for the most part, most of these diseases are not preventable.
Wow. Prevalence. How prevalent is rheumatology in Bahamians?
Right. That's a very good question. I have been trying to work for over 4 years now. We're trying to, we don't have enough data to determine the prevalence. I can only say from a clinical person looking on in terms of how many patients I see, but we know that maybe it's because of our genetic pool that we do see all of these diseases. So it definitely is, they're prevalent in the Bahamas. In a worldwide estimate, for example, autoimmune inflammatory diseases and connective tissue diseases, they occur between 15 to 20%. In the US, the prevalence is about, I would say between 9 and 15%. So it depends. And the population in particular, there are some diseases that are more prevalent in certain genetic or ethnic backgrounds. And so it varies. But I know we're trying to come up with more data so that we can, get this information.
What about treatment options for rheumatic conditions? What are some of the options that are available?
Right. As a rheumatologist, I, at least during my training and subsequent years of practicing now for over 10 years, I have been very fortunate to come in an era where the treatment options have exploded. We have a lot of treatment options for all of these diseases. For mechanical arthritis, of course, most of these arthritis cannot be reversed, but we can slow the progression through conservative options, which include physical therapy, occupational therapy, sometimes injections, and of course medications to control pain. For inflammatory arthritis, we have a plethora of options, which includes systemic steroids, which should only be used to treat acute disease, but more for maintenance medications, we have what we call disease-modifying anti-rheumatic drugs, and all of these drugs are immunosuppressants, which means we use these drugs to block certain pathways to manipulate the immune system so we can control the autoimmune disease. And then more recently, with the onset of more I would say cellular as well as and genetic engineering, we have had a lot of advances by using gene therapy, proteins, and cellular patterns to actually change the autoimmune, how the immune cells work in order to treat autoimmune diseases. And so that includes a lot of the meds that I use presently. These can be range from pills to injections to infusion medications. They come under the umbrella term of biologics, but these medications have revolutionized the rheumatic disease in general, because not only is our goal to treat the patient to feel better, we actually can stop the disease. So we're no longer seeing patients now with deformities, for example, in rheumatoid arthritis and psoriatic arthritis and in the spondyloarthropathies, and the list goes on. We can now prevent patients from going into renal failure with lupus, for example. All that being said, many of these medications are very costly, unfortunately, but we have been able to have one or two of those medications on the formulary, the government formulary for NHI. So we have been able to use these drugs on a regular basis.
And most times persons with these types of rheumatic conditions, are they taking this medication daily?
Right, that's a very good question. Not all of the medications are given daily, but the point I think you're trying to make is that do we have chronicity in taking these medications? And yes, we definitely treat it just like any other chronic disease for patients with autoimmune arthritis, patients with connective tissue diseases. The medications are long-term. I talk to my patients and we try to, what we deal with now, to be more specific, is precision medicine in rheumatology. And that means, again, using these different medications which have actually very specific areas that they work on in the immune cascade to block certain diseases or to block certain activity that brings on disease. And so when we use these medications are typically used long term. Sometimes they're only given weekly, twice a month, once a month, and we have medications that we even only give once a year. But the point of it is we do not stop medications until we achieve what is called clinical remission in our rheumatology patients. And so I have this discussion all the time with my patients because I want them to understand that it's extremely important to follow the protocol in terms of what the treatment offers, because the outcome is significantly different comparable to somebody who is non-compliant or who never seeks therapy in the first place.
What is amazing is you talked about remission and reversal of these rheumatic conditions, which I didn't know. So there is a possibility where it can be either reversed or someone suffering from some of these conditions can go into remission.
Yeah, definitely. We've had patients who have extremely high disease activity, but that is a clinical criteria as well as based on laboratory values. We check inflammatory markers, etc. So when they come to me, they might not be able to function. Like I was mentioning before, can't do regular daily tasks. Some people can't even walk because of it involving, for example, if you involve low extremities, certain joints like the knees, etc., the hips. And when we get these people on the medication, when they're on the right dosing, they can maintain or have a normal life, a life that is not dependent on everything they do around controlling pain. And they can actually be able to interact and go to work, interact with their family, go to social activities, and do the things that all of us are very appreciative of doing and living a regular life. And so this is very important because the quality of life is extremely important for most of us. You know, we want to have a normal quality of life that will allow us to do the things that we are used to doing. And so this is what these medications, being consistent with, well, first of all, I should say getting a diagnosis, being monitored, taking medications, and just being able to, watch that progression from, where you were in chronic pain to someone that's being completely independent and being able to live normally.
What role does a diet play or healthy eating for someone with rheumatic conditions?
I get that question all the time. Bahamians love to talk about diet.
Right.
And diet is very important. But for example, I tell patients, adapting a healthy diet. By that I mean a diet low in processed sugars, right? By that, let me explain that further, meaning sugars that are, not white, for example, just regular, for example, sweet drinks, sodas, cakes, cookies, etc. Trying to avoid those processed foods. Also a diet that's limited in red meat. So almost adopting a Mediterranean diet, which is high on fiber, high on fruits, high on vegetables, all along will help any type of inflammatory arthritis. Can it reverse it? No. That's the thing. So this is to help because those things help all, the whole person, I should say, to be healthy. The other thing, there are some arthritis that are heavily diet dependent, and most people are familiar with this. Everybody said, my gout, I'm just gonna stop eating meat. For some persons, that can work, but honestly, changing the diet in gout only affects it in 3 to 7% in terms of the outcome. So, because plenty of the issues with gout has to do with how we process urate, meaning, how we excrete it from the body, which is through the kidney, and how much urate is produced in our body. So some of those things we cannot control, of course. Right. And so, but all in all, the point is with gout, there are some things we can change, and that includes alcohol consumption, and particularly beer. Some of the men don't like that. Wow. But I tell them you could go and drink wine. And the other thing is, for example, eating foods high in nitrogen, for example, like beans and red meat. Some of those things increase the risk of gout. So those are things that you can stay away from to get better control of the disease. But the connective tissue diseases, not much other than what I had mentioned before in just adopting a healthier lifestyle.
Well, when we come back, we'll talk about some advice that you can give to patients who suffer from rheumatic conditions, and we will talk about what Doctors Hospital, what you have to offer for persons who may have some of these symptoms, and why it's important for them to come in and get checked out and be diagnosed, and the treatment options available at Doctors Hospital. Stay with us. Sure. We will be back right after this.
You're watching the ZNS Health Zone.
In Grand Bahama, our lamp just got brighter. Introducing Lamp Ultimate. From unlimited urgent care visits
So we're just going to give you some oxygen.
to unlimited primary care visits.
How can we help today?
From unlimited x-rays to unlimited ultrasounds.
My baby!
And spend no more than $40 on non-specialty medication. Lamp Ultimate is the affordable healthcare plan that you've been dreaming of. And it's only available at Doctors Hospital in Grand Bahama.
We all need to save time, gas, and money. Shopping at Save More can help you do just that. Make us your first stop for all your prescription needs and medical supplies. Get all your health and beauty items at the same time. And don't miss our huge choice of snacks to satisfy your cravings. And the largest vitamin selection and over-the-counter relief products. Need diapers and other baby care items? First stop, the new section for makeovers, cosmetics, and beautiful jewelry will make you sparkle for that next special event. Save More Drugs, your more store.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases across multiple specialties, including rheumatology, dermatology, gastroenterology, and endocrinology. We also provide the latest in therapeutic options for COVID-positive patients. Why choose Doctors Hospital? We provide quality, highly specialized care with Doctors Hospital physicians and trained infusion nurses you can trust. Seamless medication approval through our pharmacy and registration services, a safe and comfortable environment, cost-saving benefits with copay waived on medications for insured LAMP members, payment plans for the uninsured, and immediate access to emergency services. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to the
You're
ZNS
watching
Health
the
Zone, where we've been delving deep into the world of rheumatology with Dr. Anishka Rolle. And as we wrap up, Dr. Rolle, do you have any advice to patients?
Yeah, definitely. For patients, I think you definitely need to think about all the stuff that I had just mentioned, which includes being very alert and to some of the symptoms that might suggest that your arthritis is more than just mechanical arthritis. Even if you just do have mechanical arthritis, if the arthritis is limiting or impairing your function, then it's important to consider getting further evaluation for that. And that includes going to your doctor, and if your symptoms are not being improved with pain medication, then asking to be referred to a rheumatologist as indicated, so that your joints can be evaluated further and so that we can see if there's anything else going on that might need intervention beyond medications. And like I mentioned before, there are many things that we can do prior to doing surgical treatments. For the other patients that might have multiple joints involved or have some of the systemic symptoms, and again, this includes fevers, weight loss, poor appetite, difficulty just being able to ambulate, meaning restricted mobility, whether that be in one or multiple joints, then they definitely should seek further care beyond their primary care doctor and be seen by a rheumatologist to have more specific evaluation.
And it's important to remember that there is hope, especially with some of the latest advancements in medicine and technology, correct?
Exactly. And these diseases are not, it's taboo. We used to think that there was nothing that you can do. You just have to be, I guess, accept that you have arthritis, but no longer is that the case. You can seek therapy. There are many options for therapy. And like I said, I try to personalize care because every patient is different. And so we try to practice precision medicine, which means providing the best care option for you so that you can have the best outcome.
Doctors Hospital, talk about your rheumatology department and some of your special offerings, as well as treatment offerings, I should say, for your patients.
Well, at Doctors, we provide our specialty care services at our clinics, mainly Luden and CMC. Of course, inpatient treatment includes for those persons that might have acute care issues that arise, whether that be connective tissue disease or inflammatory arthritis. So we provide those services. For outpatient services, I will speak mainly on the infusion center, which is a very important part in terms of what I do. And it's because many of my patients and many other actually specialties, for example, gastroenterology, infectious disease, endocrinologists, neurology, and even renal docs have patients that require our services. We infuse some of those specialty medications that I mentioned that has to be infused either monthly, sometimes every other month, etc. So that's one thing. But we also offer other services like providing IV care, IV hydration therapy, multivitamin nutrient therapy, and in some cases we do blood products as well. For persons that have infections that require long-term antibiotic management, we also provide that as well. So there's a lot of options that you can get for outpatient rheumatology care. Other options that hitting on the interventional spot, as an outpatient, we provide services for joint injections, tendon sheet, tendon and bursal injections, and many of these injections require steroid, but we also have newer therapy that includes hyaluronic acid and gels that we put into joints.
You mentioned the IV rehydration therapy. What is that all about, and how does that work to help patients with these rheumatic conditions?
Well, the IV hydration therapy is not specific, I should mention, I'm sorry, to just rheumatic diseases. We give those to anybody, for example, in which there's an indication. And for example, that might include persons who have low energy, persons who might be deficient in certain vitamins like vitamin B12, folate, the list goes on. It also provides nucleic acids and amino acids that patients might not be able to get through their diet, and so we provide that in IV infusion form, and they're pretty easy. There's very minimal risk, and the cost is also very equitable to most people, at least affordable, I should say. So those are options not just for my rheumatic patients, but options that we provide for anybody across the board who obviously don't need, and have any contraindications.
Amazing. And a lot of people are now getting into the hydration therapy, correct?
Right, exactly. But we try not to, we do not subscribe to like boutique medicine, doing it, for example, only after hangovers, like after excessive alcohol consumption. But there are people who really cannot absorb certain vitamins, or persons who do require some form of alternative or in addition to medication when they have excessive fatigue, headaches, even patients who suffer from other myofascial syndromes, that is just pain hypersensitivity syndromes like fibromyalgia. So we provide these type of therapy because they give alternative source which will allow you to have less need for oral medications, for example.
What are the risks? You mentioned that there are minimal risks with the hydration therapy.
So what are the risks of the hydration?
Yeah, you mentioned minimal risk.
Right.
Mm-hmm.
Well, of course, with anything that we're giving from outside of the body, because we have to use peripheral and outside catheters to get, there's a risk of infection, but the risk of infection is negligible. It's just like getting a regular IV infusion or drip. Mm-hmm. The other risk for some persons, again, this is why we do a proper evaluation, particularly persons who might be over a certain age or who have high risk comorbidities like heart disease or hypertension. So one of the more common risks associated with those persons would be fluid overload. So if a person has a risk of cardiovascular disease in which they have congestive heart failure, IV therapy is not a good option because you should be on a restricted fluid intake. However, that in itself is not an absolute contraindication, because if your heart disease is controlled, meaning if you're on the proper medication, then you can still also partake in these type of options of treatment.
And as we wrap up, for persons who are watching this program, how can they find you at Doctor's Hospital here on the island of Grand Bahama? I know you come over at least once a month. Right. How do they make an appointment to see you, Dr. Rolle?
Right, that's a good question. So at Freeport, Freeport Clinic, the Freeport Grand Bahama Clinic, we have patients, they call in and they can get appointments through that option as well. They can also have their regular doctor contact us and send referrals for them to be seen through that clinic as well. And we definitely try to work with our family doctors, our internists, so that they know when I'm coming in town, so that they can be seen on a regular basis.
Well, thank you so much for being with us, Dr. Rolle. Today you have given us a wealth of knowledge as we provided a spotlight on rheumatology. Dr. Rolle has shed light on this vital field of medicine, covering everything from its significance to the latest treatments and challenges faced in diagnosis. So remember, if you or someone you know is experiencing symptoms of a rheumatic condition, don't hesitate to reach out to a specialist. And for those already managing these chronic conditions, remember to prioritize self-care and self-support. Thank you for joining us on this journey through rheumatology. Until next time, stay informed, stay healthy, and of course, stay tuned to the ZNS Health Zone. I'm Shashina Rolle Parkinson. Thank you so much for being with us.
You're watching the ZNS Health Zone. ZNS Health Zone is sponsored by Doctors Hospital. Also sponsored by Save More Drugs.